Well, I want to welcome everybody to our practice success stories, and today I'm joined by Dr. Godby. He earned his 4-year ND medical degree from the National College of Naturopathic Medicine in Portland, Oregon in 2004, and also has a Master's of Theological Studies from Maryknoll College of Theology as well. Dr. Godby was one of California's first licensed primary care naturopathic doctors, and is nationally known diabetes and abdominal fat loss expert, and is the medical director of the Sacramento Naturopathic Medical Center in Sacramento, California. Dr. Godby was the founder and co-director of The Run, Moving Natural Medicine Forward, and ran 3,000 miles across the United States at a 30-mile-per-day clip over 4 months to promote a healthier America and to increase the visibility of naturopathic medicine. And in 2012, Dr. Godby was named California Naturopathic Doctors Association's Doctor of the Year. So very happy to have you with us, Dr. Godby. Perhaps you might be able to share a little bit about your practice, about the type of patients that you see, and the work that you do.
Well, first of all, thank you for inviting me on the call. Love to discuss what we're doing here and how the work that you're doing has been benefiting our practice. At the Sacramento Naturopathic Medical Center, we're primary care mostly. We do pretty much everything other than cancer, and oftentimes that I will send patients with maybe specialty endometriosis or other things to other naturopathic experts in the area. But I do a lot of, my specialty is diabetes, and do a lot of metabolic syndrome and insulin resistance, abdominal fat reduction, as well as a lot of adrenal fatigue and Hashimoto's and thyroid, and a lot of hormone-related bioidentical hormones, and then a lot of autoimmune disease, and pretty much do the most things that a naturopathic doctor would do in a primary care setting.
Wonderful. Given that, my work has been in, sort of more of the assessment and diagnosis, and I'm kind of curious what assessment tools you're using, especially when you're talking about bioidentical hormones and metabolic syndrome and reducing abdominal fat. Can you tell us a little bit about some of the diagnostic and assessment tools you use in your practice?
Sure. Well, we do a lot of blood testing. We do blood testing on all patients. We have a basic panel that we actually have called the Dr. Godby panel, and we have that have been expanded. And we do a lot of insulin and vitamin D and a lot of cardiovascular markers. We also do a lot of saliva testing for hormones, for adrenal glands and progesterone, estrogen, etc. A lot of heavy metal testing, as well as stool testing for probiotics and for infections that oftentimes lead to autoimmune disease, and just a whole host of functional medicine testing, markers that we learned in school and then tests that have come out. Do a lot of neurotransmitter testing, serotonin, GABA, dopamine. So those are some of the most common tests. Do a lot of food allergy tests as well, hidden and delayed food allergies. So it's nice to know what in the beginning of when a person starts with us, what actually they're allergic to, at least at the present time, be able to find out and move from there. And so it gives us a little bit better idea what that person should be eating, since that's such an important part of what we do.
Right. Given obviously the blood testing sounds like that's a fairly important part of your assessment and clinical work. Is that something that you typically order on every patient, a full chem screen and a CBC and that type of thing?
Well, it's so much so that I've kind of gotten fairly dependent upon it. It's the assessment tool. I usually say it as a marker that if I don't have the full panel, that it's oftentimes like a chiropractor not being able to do all the x-rays that they need, or a dentist not being able to x-ray all the teeth. It's like doing half the teeth or a quarter of the teeth. And so it really every single marker that I've learned through your program, all the way from the beginning, has been instrumental in terms of looking at different key markers. Like I was just talking this morning about the LDH and hypoglycemia. It's about a third of my patients have a low LDH below 140, and there's about a 90-something% correlation with hypoglycemia. And I never learned that in medical school, and it's something that I learned through your program, and it's really been helpful in terms of helping to. I had a patient call at a 15-minute appointment this morning for a patient prospect, and And she asked if I treat hypoglycemia, and I said, yes, I do. It's just one of the common things I do. And this is just things I take for granted at this stage that most, a lot of practitioners, especially MDs, but just practitioners in general, don't know because they haven't been through that program. And certainly your book in the beginning always gives me those tools as a starting point, and I still use that book. It's surprising that it still has bindings left in it.
I hear that quite a lot, actually. So, I mean, it's interesting that the blood test is probably the most common blood test, or most common diagnostic test ordered pretty much on the planet. And we have this strange thing that happens because traditionally trained medical doctors, osteopathic physicians are looking at it through a particular lens. And, the people that I work with, the common thing is they go, I'm not feeling very well. I've got all these signs and symptoms that are going on. I go to my doctor. I get this test that's meant to be sort of the gold standard for identifying what's going on. And the doctor says, quickly runs through, well, your kidney's looking good, your liver's looking good, your cholesterol's a little bit high, there's no anemia, and basically everything seems to be normal. And yet the work that we do, I very rarely see a normal test.
I don't think I've ever seen where everything was within optimal range. That's absolutely huge. And again, a lot of times when I see the work of other practitioners, including people in my own profession, without this background of the optimal range, that oftentimes they will miss things like hypothyroidism or high triglycerides or whatever the case may be. I see that every day in my practice with conventional medicine in terms of patients will bring in lab tests from their doctors, and hypothyroidism will be missed, eosinophil counts will be high, and oftentimes parasites are missed, triglycerides are missed, vitamin D. It's just absolutely huge because the difference between the reference range, the standard reference range, and the optimal range, you look at a standard panel coming from a doctor, even with as many markers as we do, oftentimes there's nothing, everything is within range. But you look at the optimal and Dr. Weatherby's optimal range, then you'll see about, maybe 10, 15, 20, 25 things out of range. And the person really has felt terrible, even though everything was within range. So I see this every day. This is a major, major part of my practice, and the things that I explain to every person that comes in for a B12 shot. I usually give them a shot, and then I also explain about that optimal range because it's an opportunity to tell them about that, because I think that, and I even tell them to photocopy this optimal range and send it to friends and family all over the United States, so that when they go to their doctor, they will have they will be educated about what to look for.
Oh, that's great. And, Dr. Godby, you've been studying with me for many years, and it sounds like my book is in pieces all over your floor of your clinic. But I'm curious, obviously we have a software program that I developed and released, and you were a very early adopter of that. And I think if I look at the statistics, I think you've run over 1,000 lab tests through the system. I'm just curious, kind of like from a before and after perspective, what life was like for you and me. I mean, I can speak for my own self. Doing a manual analysis of blood testing using a book or tracking forms, and what that was like, and maybe compare that to kind of what software tools give you in your practice. Yeah.
Well, it certainly saves me a lot of time, which is good, because then I can focus on other things. I certainly don't want to get sloppy and just depend upon the lab testing, because it doesn't cover every topic, just the most major categories. But it certainly saves me time. It also looks very professional to the patients to see something coming out in the software using modern technology. It's really nice to see all the labs laid out from all the previous, and oftentimes we'll go over the sheet that has, a lot of times people will be doing lab testing 3, 4, 5, 8 times, and it'll lay it across and see the improvements that they've been making. And that's really a nice and sophisticated way of approaching that. But it also helps me to expand my awareness, because as a human being, I might miss a few things at time to time, getting in a rush. And so it helps me to make sure that I don't miss anything. It's kind of a double checking me. And it also helps me to think through a little bit more on that. And so it's just really a great tool. to be able to use. And it's certainly worth, every penny I pay for it because of the fact that, again, the time it saves me, the professionalism it has on that, and definitely has been a big part of why, my business has been very successful over the last few years since we've implemented that.
Great. That's really good to hear. I'm curious, you mentioned, so when you do B12 shots that you talk about these optimal ranges and you give the optimal ranges to your patients and tell them to share it with their friends and family. I'm curious what the experience has been for patients, kind of having a report that sort of lays out kind of a roadmap of potentially where they are and where they might be going. Do you find that they share those reports with people? Have you had any feedback in terms of, getting new patients to the clinic because of reporting and because of the tools that you use?
Well, one of the things that I think that it definitely does is build a rapport oftentimes with other doctors, because what will happen is they will take and share that report with their doctor, and the doctor will, oftentimes be impressed about, the results. And being able to see that, or even if they don't say much, they're kind of. I can definitely see that in the last 10 years since I've been in practice, that the credibility within the medical community has increased, and so that can only help. I mean, it's not necessary, but it's definitely beneficial because then that brings credibility within that patient and it kind of builds their belief. Overall, it's really been beneficial with patients in terms of being able for them to be able to see that. There really is a huge difference, and the number one reason why patients come to me is not because of using natural medicine. That may be number two, but number one is because the doctor doesn't find anything wrong, and the reason they don't find anything wrong is because they don't look at it in a functional medicine way. They do very few tests, blood tests, which is the common language between MDs and NDs. They do very few tests. They don't find anything wrong, and the patients come to me and they say, "My doctor told me there's nothing wrong, but take these antidepressants just in case." And so it's just really medicine that it's really every day I just shake my head and in almost a disbelief. I see it every day, thousands of days now, and it's still hard for me to believe that we're considered to be, not the real doctors. But I think that the patients are very much impressed by what they're seeing, and that the blood chemistry report only gives us more credibility within the patients, because again, we're still building the belief. Some patients come in and they're kind of a little bit skeptical. They may want to do some things the other way, but they're skeptical about naturopathic medicine and about what we're doing, functional medicine approach. So it just really builds the credibility, and it really gives them an outline of what could be going on that just blows away what they get from the doctor. And I think that's really, I try to speak very respectfully about doctors in my office. I never try to disparage practitioners. I just don't think it's a good idea coming from a non-medical perspective. But at the same time, patients can see that, and they can see that there's a huge difference between what we're doing. And the blood chemistry report is just kind of an upgrade from the book and all of those things. It just gives us a much more handy tools. And I would, as American Express says, I wouldn't leave home without it, or
Great, thank you. Well, I guess a final question. Both you and I are NDs. We graduated from the same college in Portland, Oregon. I know from my discussions with many NDs across the country, and I'm sure you do too, is that some of them are, struggle in practice. And I'm just wondering if there was anything that you might have to share with our colleagues around functional medicine, diagnostic tools, assessment tools, that type of thing that could maybe help them jumpstart the way that they work with their patients, and speaking from your experience in the field.
Yeah. Well, I starting a practice at age 48 and delivering newspapers all the way through medical school for 5 years, I was a little bit insecure about my knowledge when I came out. So I knew I had to hit the ground running. I had a family to support. I was moving to Sacramento to help. I wanted to stay in Portland, but because that's where I lived. That's my, I wanted to live there the rest of my life. But I felt like I had a calling to come back to Sacramento, and it was not easy to move. And I put that as part of the story because sometimes I think we have to do what we have to do to be, if we're going to make a profession out of this. My preference was to stay in Portland, but this is where the people needed me. So the first choice was to come to Sacramento and to embark on a new journey for my family. And so and I think really the first prescription was working hard, and then through your particular program, I'm working smart now. And I think that a lot of NDs it's not, or I say some NDs that I've run into, that I think that the whole working hard, there's really no substitute for putting in the hours, just the quantity of time that's necessary. But it's also, I think, through your program, we're working smarter, because sometimes it's not just about how hard you work or how many hours you're putting in, but it's also working smarter. And so the software program and the books and every part of the functional medicine that we did over the years really helped to. This has been the most significant thing to my practice of anything I've done, and your influence with me has been bigger than any ND in America, and after I left medical school. So this has been very significant professionally, business-wise, and I always tell people that Dr. Weatherby is the one that will help to bridge the gap to help you be a better doctor and also to be better business, because ND's business and NDs don't usually go together too well in terms of, but we don't really think about business and financial. It's not really a big consideration oftentimes in the way we think. We become doctors because we want to help people, but we really don't think about our financial. And then a lot of people go out of business because they're not putting enough effort and time into the business-wise. So a program where a person is, such as yourself, is really dedicated to helping people to succeed financially and succeed medically to be a great doctor, those are very rare individuals.
Well, I thank you very much for those kind words, and many congratulations to you on your success. I know you're very busy in practice, so I want to thank you again for taking time out of your practice to join us today and share your story. And again, wish you all the very best as we move forward. And thank you very much, Dr. Godby, for sharing your story with us today.
Well, thank you for inviting me, and I've enjoyed participating any way that I can help to other NDs and other people, chiropractors and other people around the country that do in functional medicine to succeed. That's why I ran across the United States.
Fantastic. All right, Dennis. Well, thanks everybody for listening in today, and we'll be back with another success story at some time in the future. Thank you.